We're continuing our series this morning on the dangers of skipping medical care during the pandemic. This morning, getting some important advice for anyone who may be suffering from diabetes. We're joined by Rhonda Solomon, a nurse practitioner who specializes in diabetes care. Dr. Solomon, thanks so much for joining us.
Thank you.
I called you doctor, nurse practitioner.
Yeah,
sorry.
I was going to say I'm a nurse practitioner.
Yes, which is just as important. And so when we're talking about care during the pandemic, we've talked about this over the last few weeks. A lot of people are skipping important things because they're worried about even going into the clinic, going into the hospital. With diabetes specifically, what can be the fear for people who are treating people with diabetes if they do skip care?
It's very dangerous to delay care for people with diabetes. Diabetes affects your entire body system. It's one of the leading causes of blindness in the United States, heart disease, stroke, kidney failure, and limb amputation. And it's important to realize that all of those things are preventable if you can control diabetes.
Mm-hmm. And
communicating with us is very important, and there's a lot of things that we can do to help for people that do feel afraid.
And Rhonda, for people who may already have the diagnosis, so they are aware that they have it, what are some things that maybe you've seen in your own patients who are delaying care right now?
I think that they start to feel worse for sure. You know, certainly having high sugar makes you feel more tired. It makes you be less active, and sugar just continues to go up. And eventually people with diabetes feel depressed and they don't feel well taking care of themselves, and so they don't, and it's sort of a snowball effect that just makes things worse all around. And so the best thing to do if someone does feel, afraid about coming in is to at least communicate with us. Call us, send an email, or visit the website and go through the portal, because we certainly can help remotely.
I was going to ask remotely, speaking of that, can you do telehealth appointments to sort of figure out what's going on or even get to diagnoses? How do you do that process?
We do telemedicine visits and on a variety of platforms, and I think that it's worked very well, not even just for people that fear COVID, but for work reasons. I think the best thing to do is to come into the office, of course. Human contact is the best, and I think people can expect when they come in to feel comfortable. The office is busy. We're following the guidelines that have been recommended, and I think when someone has their first visit, they definitely feel more at ease. It feels like healthcare is in control of this, and we know what to do now. We understand what's coming at us. Our precautions hopefully will help lessen, the effects of other things like the flu and common cold.
Yeah, I mean, you have to stay healthy, right, to fight any of these viruses.
Right, exactly.
Rhonda, you mentioned blindness and some of the long-term effects of living with diabetes if it's not treated properly, but what are some early symptoms if someone may have developed it over the past few months and not realized it that they can look out for?
That's the difficult thing about diabetes. Often there isn't any symptoms until there's permanent damage, and especially with eyes. I kind of preach that every day when I speak to people, saying just because you don't have visual changes, you still need to get that annual exam. A lot of times people have symptoms, maybe blurred vision, or they see something in their visual field that caused them to seek health care. But it's very important, even when you don't have symptoms, to monitor these things, because sometimes when you get to the point of having symptoms, the damage is permanent and you can't do anything. So I urge people in every aspect, to do your preventative visits and just to make sure.
Yeah, and then one piece of advice maybe for somebody at home who's listening to this who does have diabetes for treatment right now.
Well, my best advice is to keep your circle small as recommended, but include your healthcare provider. Call today and make an appointment, or share the information, symptoms that you may or may not be having and what you're afraid of.
Good advice. All right, thank you so much, Rhonda. We appreciate it.
Have a great day.
You too. Weather